Welcome, ma'am. Welcome to Love Youth Cancer and ZenOnco.io. I'm Justina from ZenOnco.io. This is our cancer healing journey talks where we invite speakers who have gone through cancer, maybe as patients, caregivers, or survivors. These CHs are very close to our heart because many patients tell us when they listen to others' journey, it inspires them. It helps them to boost their confidence and also gives them hope that if others can successfully beat the disease, why can't they? So, thank you so much, ma'am, for joining for today's cancer healing journey talk. So, could you please introduce yourself and talk about your mother's journey?
Thanks, Justina, for inviting me. I really appreciate the kind of work ZenOnco is doing in this field. I'm Anuja, and I will be covering my mother's journey. She was a cancer patient, a CA pancreatic patient, and her journey I will cover, which she passed away due to cancer in the year 2011, and that point of time it was very difficult. In India, the treatment, the diagnosis, it was not that advanced. Now we have come across 10 years ahead, and we never had such cancer care camps or healing circles wherein we could talk about these things. So it was kind of a very nascent stage at that point of time. So I will talk through her journey. My mom, she was a hale and healthy person, and suddenly at the age of 54, this all started. And uh, because the diagnosis could not happen at the right time, maybe we it got delayed little. Because of that, we lost some time, in because we they were kind of treating other things and not understanding what's really happening. So I still remember it all started with a fever, a high grade fever in the year 2010. And that fever lasted for around 20, 25 days. And they were doing multiple tests to analyze why this fever is coming. And they were doing the test, but somehow they could not find out what is the reason. They were treating for liver disease, something, so treating for liver and treating for the blood. There is something in the blood, an infection. So that entire 2 to 3 months were lost in that process. And finally, there's this institute in Delhi, Institute of Liver and Biliary Sciences, ILBS. So there we got the diagnosis done at the end of at least 3 months struggle. So after she took admission there, around after 3 4 days, they could diagnose that it is a pancreatic cancer. But they still said it is second stage. So let's see what can be done. Can we do any process? And it was a pancreatic head. So and there's a specific test, marker test for cancer, that is called as CA19. I think you will be aware. I would request, and through this medium, I would want to tell everybody, if anybody is having any symptoms, so please go for that marker test. So that can give you, because that point of time we were not aware there is any such a test, which a blood marker test it is, which can give you information that whether the patient has any kind of these symptoms. So then after that test report, it was confirmed, and then they did multiple scans and other things and MRIs, and got to know that it was a CA pancreatic, and it was at the head. So after multiple deliberations and showing to multiple doctors, some certain doctors suggested you should go for a surgery, and certain doctors suggested no, go for chemotherapy. So there were multiple opinions coming from various sides, and finally we decided we will go into this All India Medical Institute, AIMS Delhi. So she was a patient of AIMS Delhi, and the treatment was going on there, and she could withstand successful chemo sessions of around, I think, 10 to 12 cycles. But then it recurred again, after a period of 6 to 7 months, and then it had spread to liver and lungs and other parts of the body, and then it was very late, and we did some a little bit of surgical process also, but it did not go into the successful way. But then it was, it is shattering when you go through all this process and you are not aware what's happening. Suddenly she was a professor in botany, and suddenly what is happening to a hale and healthy person? He is going to office, he's working, and suddenly in 2 months, 3 months time, the person is not even able to do the daily activities. So that was kind of very shattering at that point of time. And I am the elder sibling, so it was kind of the responsibility lies on the elder ones. The younger I have a younger brother. He was still studying in college. He was in his final year of college, so for him to kindly recoup with it was very difficult at that point of time.
I understood, ma'am. It would be very tough for you because it
I'm
happened
I'm
all of
just
a sudden.
revisiting it after 10, 11 years today. Talking to you.
Yeah.
But yeah, I wish we had platforms like this wherein we could have some guidance on how the the topic, the guidance on various things, what is to be done. But at point of time, it was like, uh, no, we should not disclose it to anybody. It was like hidden things. But now things have changed over the last 10 years.
Yes, ma'am. Glad that you are coming forward and sharing your mother's journey. I'm pretty sure that you did your best as well as a caregiver and as a daughter. So, ma'am, could you tell us that what exactly were the symptoms in the beginning and before getting diagnosed?
Yeah,
And
yeah, yeah. I would really want to emphasize on that, because if anybody is experiencing symptoms like this, they should get thing tested. See, she had loss of appetite. That was the first thing. Loss of appetite, difficulty in swallowing, and suddenly her sugar levels became high. So if any, without any reason, if anybody's sugar levels are high, please get checked for the pancreatic, get the pancreatic things checked, get the pancreas checked. Because that point of time, actually doctors also were not aware that the sugar elevation, because she was not a sugar patient, and suddenly it was shooting above 300 and all. The doctors also were not aware that to correlate pancreatic thing with the sugar. This, but then this, if in suddenly the sugar levels are going high, and you have loss of appetite, you have fever, you have difficulty in swallowing, please check your pancreatic things properly. So that were the major symptoms. Loss of weight that happened over a period of time, over 2 months. She lost around 10 kgs, 10 15 kgs. But then the first primitive symptom was this: suddenly the sugar levels got high, and then this she was not able to eat anything. She was saying, I have difficulty in swallowing, and fever, fever for around around 15-20 days. So initially, doctors suggested that it might be a liver problem, it might be liver cirrhosis. They were checking for that, but no, none of us could think about pancreas. Even the doctors, even we are kind of laymen, we don't know in these things. But even the initial doctors who got her checked could not think of there will be something wrong with the pancreas.
yeah, ma'am, you very briefly you shared the symptoms of your mother and also the thought matters that you are still specifying that symptoms are very important because it's very hard to get diagnosed with cancer if a person has like this, as the symptoms should be very severe, then only doctors can
Uh,
actually find it out.
Another
Whereas,
thing, what was it? She had multiple ultrasounds done, but the ultrasounds could not catch it, uh, because it was head of pancreas. So it could not. Maybe they were not very specific. The ultrasound machine could not catch it, and later the MRI and all could catch.
So,
What
ma'am,
I
was there any family history from your side?
no, no family history. At least I am not aware for the next last 2 3 generations. It was not. But now I now that during the treatment process, I heard that the cancer has the family. I myself am scared for. I am myself scared for me.
Yeah, I can understand, ma'am. So, ma'am, as you said that according to your knowledge, there were no family history. So, what was your first reaction and your mother's first reaction and all your entire family members' reaction when you got to know that your mother is diagnosed with cancer?
At that point of time, we were thinking that it will, till last moment we were thinking she will recoup and she will recover from it. But I think deep down inside she was aware that this is not going to be uh, easy, or she might not come out of it. She was inside aware maybe, but she never disclosed with us that I'm getting such kind of thought that. But we were very hopeful that something will happen, and she will get cured. And because after the initial chemo sessions, 3 to 4 chemo sessions, she recovered for a brief period. She recovered, her appetite improved, she could eat, she could walk, and for a couple of months she was okay. But as the sessions of chemo progressed more, we were in some fifth or sixth session, seventh session, it started deteriorating again. And in the whole process in between, we tried other alternative medicine also, or like to maintain the platelet count. The platelet count goes down when you are in the chemo and you feel that nauseatic sensation, then the platelet count is down, you can't go for the next cycle. So all that we have seen on the way. But then for the alternative medicine, we had this wheatgrass therapy. I'm sure you will be aware about that. I think patients are taking that um, wheatgrass juice, and then giloi, that she used to drink that to maintain the healthy platelet count. So emotionally, yeah, it was like, maybe for us, beginning months where we were trying to understand what's happened suddenly. And during the same time, my dad had an accident, so he was on bed. So it was a very tough time at that point of time. So he had a surgery, he had a fall, and he had a surgery during the same time. So yeah, it was tough. And but she was a very would never express that. She never wanted the kids to face that, what's it. And she was still tried to be cheerful, and never said that what's happening, and whether I will be able to. She never said that whether I will be able to recover or not. No, she was always in that mood. Yeah, it is going to be okay. And I will, because I was staying in Bangalore, and my parents are in Delhi, so I used to shuttle between Bangalore and Delhi, being working, traveling there, and like it was tough only. But then she was saying, no, when I will become okay, I will become okay. I'll travel with you to Bangalore. But then, yeah, maybe inside she was knowing that it's not that easy.
Yeah, ma'am, indeed, she was a very strong person because just to cope up with the treatments and the cancer itself, the person has to be strong.
Yes, yes.
So yeah,
Treatment
she
part
was.
itself, I have seen for the patient, the treatment part itself makes you so weak. After the chemo, then you have that vomitings, and you're not able to eat. So that itself is uh, something. So the best thing, what it would be, to diagnosis should happen early, so that you have some window and you recover faster.
I completely agree with you, ma'am. Yeah, the diagnosis is the beginning of the cancer journey, and which is very important.
I think therein, we were, as a family, were feeling bad. We lost some months in the diagnostic process. So we kind of 2 3 months were lost in looking at what really has happened. So that time frame, if I don't know whether it would have turned other way out, but that 2 3 month critical months we lost initially in the diagnosis. So the diagnosis process, if it happens at the right time, maybe she would have survived little longer. That's what
Yes,
was
ma'am.
our
Right.
thought at that point of time.
Yeah. So, ma'am, could you please specify the what all treatment did your mother exactly undergo?
No, there were some doctors. They suggested that we will get the surgery done, the pancreas will be removed and all. But then later, there was this HOD in the AIMS, HOD, Dr. Raina, and he suggested no, it's not advisable to go for the surgery, because without surgery, at least she can have few months. But if we go for the surgical process, it will aggravate faster, because now they say the nodules have formed across the body. So if we go for the surgical process, it will be difficult. Then just for the palliative care, there was a stunt which was done. A stunt process was done for her. That was just for the palliative, so that the pain and all will be reduced, and the liver stunt was done so that the enzyme levels will be in check and all. And the normal cycles of chemotherapy, that was the treatment. Chemotherapy was the only treatment which was done. And some palliative treatments, alternative medicine therapy, that was just to keep the patient going on in the chemo cycles.
All right, ma'am. So, as you said that during the process itself, it was very painful to watch your mother because when your beloved, especially one of your parents, are getting such going through such hard times, it's very painful to watch. And also, you said that your father also met with an accident that time, so it was pretty hard for you.
Yes,
So,
yes.
ma'am, how did you manage your mental and emotional well-being during that time?
I think when you're passing through such phase, God only gives you strength. Now today, if I think of all that, I myself, I think to myself, how did I manage everything? I had a small child, 1 year old child, and managing the child and managing the parents at that point of time. And obviously there was other support system. My relatives and all were there. The family, close family was there, so they also helped. But somehow God only gives you strength to get through all this. uh, I can say
So,
that.
ma'am, yeah, so what the things that really help you to go through the cancer journey of your mother?
Sorry, come again, the voice is breaking.
Yes, ma'am. I was asking that what all helped you to cope up with your mother's cancer journey during that time? For example, your mother's or your family relatives support, like
Yeah,
that.
the family support is what is the main important thing. Then you have to have financial stability also, because see, any kind of treatment and any kind of, you need to have little financial stability also. And my mother was herself a working lady, so that finances were taken care of, so that was not an issue. So, and then the emotional stability which comes with the family around, close family, friends, which who help you during that stage, that is very important. Apart from that, little belief in God, that things will be okay, things will be okay, that gives you inner strength. And your inner will that, yeah, you can do it, and this time also will pass, will give you strength. But the most difficult past days were the days she was in ICU for nearly, I think, 7 8 days towards the end. She passed away on 24th August 2011. So for 7 8 days she was in ICU. So that was the toughest time, seeing her go through the difficult phase wherein she had all the pipes. They were doing the medicines through the throat and all the slits. That was the most difficult days, I think, in the entire journey, to watch that. it's painful, it's painful, it's still painful. You have the memories still, you just can't erase them to see how what.
Yes, ma'am.
But that point of time, as a child, that point of time, you think that you should do everything possible uh, for her. But then now, if I look back, it feels like maybe I was being selfish and kind of troubling her to go through all that medical process. Maybe I would have taken the other decision. No, let us not put her on the machines. It's not going to help. But then maybe we are little. We think that some magic might happen and she might suddenly recover. But maybe now over the years, I think maybe that is kind of troubling the patient. You should see from the patient point of view that the last phase should be smooth, not troubling the patient with all these machines and equipments and all. That's not advisable,
I
because at
completely agree
that
with
point
you.
of time you're not able to make the decision. How can you not how can you not give that kind of but doctors were advising it is not viable, so you think and you, but we were not, no, we want to do, but I think that's not the right approach.
Yes, ma'am. As you said, I completely agree with you. The quantity of the days or life,
Yeah, it really
matters less, but the
if that,
quality matters more.
yeah, if that is troubling the patient, it's not advisable to go that way.
Yeah. Yeah. Now, as you said, the cancer treatments facilities has more
Yeah, yeah, yeah.
advanced by this time. So yeah,
Yeah,
now
at least
even mental
people
health of
are
the patient is
aware.
being important.
At least
Yes.
now people are aware. They are going for health checks every year. They're checking this, so that's important. That's important. People should take the health as utmost priority and do the health checks, and your emotional well-being, mental well-being, and the physical well-being all should be taken care.
I agree, ma'am. I agree. Even as we have, as an onco also follows the integrative treatment. So that also comes in a
So
holistic manner.
how does it help the patient? What are you guys doing during the journey with the patient?
Ma'am, for example, even as you said, the chemo symptoms are itself very painful. So to reduce the symptoms, we help them. We have supplements and we have other services which helps them to have a more uh, beneficial and more uh, quality of life during the treatment, and it actually supports the treatment what the patient is going through.
Okay, okay.
So it's a complementary treatment basically.
Mhm. Okay.
Um, Anuja ma'am, are you there?
Yeah, yeah, yeah. I'm there.
Yeah. So I just wanted to ask you that as a caregiver during the cancer journey, how did your lifestyle change?
Yeah, maybe that on that point of time that gave me a little change, and we switched over to completely. Generally, we were in that model only, but we switched over completely to the healthy lifestyle, the diet. We are a little conscious, the health checks. We are doing that because somehow we have seen what happens if your health is uh, kind of doesn't show that priority. So we have kind of moved to a very uh, informative style of living, wherein we see consumption of certain foods, which cause we because at that point of time we did a lot of research, what really causes it, what can aggravate it, what kind of diet should be taken, and so we have kind of adopted that kind of lifestyle, try to adopt that kind of lifestyle.
So, ma'am, as this was also a journey which, as you said, this also passed, but you're still holding on to the good, cherishful memories of your mother. So, ma'am, what are the top three learnings that you got from this cancer journey of your mother's?
I think the most important learning is she never lost hope till the end. So we have to be hopeful and till the end. So that is the biggest learning from the entire process. So that hope has not to be lost. So and I see her still. She passed away as a very strong person. So that will be there with me throughout my life.
Yes, ma'am. You are very proud daughter actually because uh, your mother was very strong and
Yeah.
I can assure that she literally defeated the cancer though
Yeah.
till the end.
Yes.
So yeah, she was a strong person. So, ma'am, what would be your message to the cancer patients, survivors, and caregivers who are listening to you?
So for the patients, it's a tough journey, but don't lose hope. There are there are people who have I have had many stories. I have seen many people because my mom was getting treated in All India Medical Institute AIMS Delhi, and I have seen many survivors there, and they have kind of survived and continued living for 10 years, 15 years. I still am in touch with many of them. So it's not that once, oh my god, it has come and I will not be able to defeat it. No, there are stories, there are many stories who defeat it and who can come out and start their lives again and in a very uh, peaceful way. So that is for the patients. And during the process also, be hopeful, eat well, try to eat well. We know that it's difficult to eat during the process, but uh, and try to be surrounded by family, because that gives you strength. And for the caregivers, they have to be strong emotionally, physically, financially. So in every respect, they have to be strong, uh, and whatever decisions you make, you should not keep thinking on that whether well, why did I make this decision? Had I gone other way? Because I still myself, uh, th- it's been 10 years, but still I go back and think, oh my God, I would have done like this. I would have taken first to that hospital. Why did we not take first to that hospital? We lost that. So those things, I think we should let go. That will give more strength to the patient also and the caregiver also, because here strength of both is required to pass this journey. And
I agree with you, ma'am, and I'm very sure that your mother also would have, thankfully left that her family was there for her, supported her till the end, and did their best.
yeah,
So yeah, as you said, you should everything cannot be in control of our
yeah,
hands.
yeah, we should kind of leave certain things to God. Maybe this was
Yes,
best for the patient, whatever ways it goes. We should think on those lines, which makes us maybe physically strong, emotionally strong.
I agree. So, ma'am, as you said, your mom was very brave person, and she was very strong till the end. So, if you want to sum up this cancer journey in one sentence, what would it be?
Don't worry, you will come out of it. Because now we see the number of cases are going up so high, and we see youth getting uh, uh, I have seen many young children there, uh, many young ladies, the breast cancer ladies, and so that's it. We have to keep faith and hope. Hope has to be kept alive. That don't worry, we'll come out of it.
Yes, ma'am. Definitely. You're right. So, ma'am, thank you so much, ma'am. It was really inspiring listening to you because as a caregiver, every person has to go through, even watching itself, it's painful. So, ma'am, and it takes a lot of courage to come up and share the journey, though it still aches. But yeah, you have inspired a lot and give and spreading the awareness, as you said, focusing more on the initial stage of the cancer, that is symptoms and diagnosing.
Yeah,
Um,
that's the
diagnosing.
only way which can we can have some time on hand and do something fast.
Yes, ma'am. So thank you so much, ma'am, for spreading awareness and your with your journey. You connected it, and you very well, shared it, covering all your mother's cancer journey. So, ma'am, so once again, ma'am, take care, and
Yeah,
thank you for
thanks
being
for
part of our cancer
inviting,
healing.
and thanks for the lovely work you guys are doing.
Thank you,
Really
ma'am.
appreciate
Wish you
that.
all the very best.
Yeah, thank you.
All right. Bye.
Bye.